Anytime that someone asks me the question, like, how do you do it? I say, you got to stay consistent. Like, consistency wins. Like, there's going to be times you want to give up. If you don't think that, we just kind of had a story, prior that would hopping on here. There's been many a time to those moments where I ask myself, why don't I just go to a 9 to 5 where I can just clock in and clock out and have to not worry about it? But there's also a time in my life where I said, why am I stressing over somebody else's problems when I can stress over my own? And in reality, you're stressing over your own problems. You can control everything, right? And maybe not right now the way you want to. You have to play every single part of your business, wear multiple different hats. But what happens is that when you get someone now on board, that you actually have an idea of what marketing looks like, that you have an idea of what a leader looks like and what this person should be doing. So now you have an expectation. If you can do it as good as me or better, then it's a win. If you can't do it better than me and I don't even know this world, then you're not part of the team, right? Like, that's just what it looks like, man. So it is you're learning so much, man, and it is fun. It's fun and it's challenging, and there's times you want to give up, and there's times like you're asking yourself, like, why did I even do this? Who told me to do this?
I think I asked you that too, right? Or like you said, you've been hustling for over 20 years, and I'm like, I just started. I'm learning, and I'm used to, like anyone thinking, I'm used to that every 2 week paycheck, and I've had to adjust, right? Like as someone says, you're paying to go to work right now. I'm like, yep, I'm paying to go to work right now because I believe in that long term vision. So.
Yeah. Listen, it's been 3 years. What do you hope she'd say if she saw you and what you built now, your mother-in-law?
Oh, that's a really good question, man. Um, what do I think she would say?
Yeah. What would you say with what you've been able to build? You
Yeah,
took her
yeah,
advice. You went out
yeah,
and now you're in a space of helping people.
yeah, yeah. No, she'd be happy, right? She'd be happy, you know. Yeah, that's all I can say. I think
She would
she'd
say,
be.
probably like, you finally did it. You took my advice. You should have done it sooner. You said 13 years. You should have done it 13 years ago. Like, what are you waiting for?
Yeah, yeah, but no, she'd be happy, right? Like my wife is in healthcare too, so and she kind of navigated my wife toward that, and
I love it.
and
I
and
love
and
it, man.
so no, I think it's anything, right? Helping others, not just healthcare, right? But yeah, no, she I think she'd be happy with so far kind of what I've done.
Now, as an entrepreneur,
Hmm.
there's no steady paycheck. Your caregivers could be underpaid. Families could be underinsured. How do you keep going when the math is not even mathing? Doesn't always
Yeah,
work.
yeah. So it's I I always try no matter what, and I've trained my staff this too. I said, look, I mean, the reality is in my space, home care, you have to be poverty to get some sort of assistance. Like insurance companies don't cover it. They don't. Most of them don't. It's mostly out of pocket. Um, and so you can imagine I get calls every day, and I've trained my staff of like, even if we can't help them, like they can't afford it, they've said it, give them resources, right? I say, hey, these are the resource lists. Ask them to ask for their social worker and XYZ or a case manager, or hey, check out this nonprofit. They might be able to help you. So even though we can't help them personally, like when you say the math isn't mathing, right? Like I can't, I gotta pay my caregivers, living wages as well. Uh, we go, okay, well, these are these other resources in our community that could potentially help you, or some options for you. So that's how we help people when we can't either financially make it work, right? And we always try to work with families. Some families also think that they need a lot of care,
Hmm.
and the reality is you don't need 24/7 care or 12 hours a day or something like that. We can make it work with families where you just do a few hours a day, if that, or even 2 or 3 times a week.
You said something very interesting the first time that we met. I want you to kind of tap
Hmm.
into this. So,
Yeah,
when we talk about families, there's still a misunderstanding about the real cost of long-term care,
yeah,
and what it and can we talk about what do you wish they knew before it became this crisis or becomes this crisis? Because I remember one time
yeah.
you saying, "I don't want people like in reality. I'm in this business, but I don't want you to come call me."
Yeah.
right? Like there's
Yeah.
so much
Yeah.
there to kind of break down, man. Like, and I just
Yeah.
love you become the resource, teaching people what they don't know, even when you can't help them. But you're
Yeah.
also trying to help people before they even get to this space in their lives. But people are
Yeah.
having a misunderstanding, man. Could you kind of clarify that
Yeah.
for us?
Yeah. No, it's a very good question. So the first thing I said was, a lot of people assume insurance covers home care. So meaning when I say home care, meaning caregivers, meaning it's not medical, but it's all the things for your audience that we all take for granted when we're younger, whether it's
Hmm.
feeding yourself, getting out of bed, bathing yourself, right? Going to the store. Those things all my caregivers specialize in, right? And so everyone assumes insurance covers everything, right? Whether you have
Hmm.
Medicare or Medicaid, it's going to cover this. It does not cover this. They only cover medical things, right? Enough to keep you alive. But as we know, you need to do those things
Hmm.
to stay alive. Now, the reality is most people will have family members as caregivers, like I did with my mother-in-law, right? As long as with my wife. Um, but then people don't consider that, so they don't save for that. And so what I mean by don't use my services is when we're young, Efrain, we need to take care of ourselves. Like make it a
Hmm.
lifestyle into eating right, working out, sleeping. You don't need some crazy diet or anything, right? Everyone knows what they should be doing. We just don't do it, right?
Correct.
And so we don't realize that. But when you're at 70, 80, and your chronic conditions are building up or you didn't take care of yourself, you're going to need a lot of care. And a lot of people go, oh, well, Medicare will just cover it. I'm like, if you got no family taking care of you, right? Like any
Hmm.
of that or friends, it's going to be hard. It's hard,
Yeah.
right? And as you know, the aging population, silver tsunami, right? Everyone, there's like 11,000 people retiring every day in America over 65. We're living longer, and the reality is it's going to be, to me at least, less and less resources, at least financially, right?
Yep.
To cover it. So what can you do? What's in your control? Yourself, your lifestyle.